The easiest way to give you a tour of the eye is to tell you about my eyes. You'll find out how normal eyes work and what makes albino eyes unique. The first problem I have is moving my eyes. The eye is like a ball suspended by 6 muscles. The ball is called the sclera, from the Greek word for hard. It's composed of fibrous strands that run in parallel. Think of it as the equivalent of fiber tape you use when shipping boxes. The sclera holds the eye together and maintains a pressurized eye. There are 2 muscles for left-right movements, 2 for up-down, and 2 for rotating toward and away from the nose. The last 2 come into play when you change your head position. My eye muscles work fine for each eye, but they don't work well together. Sometimes called squint-eyed, wall-eyed, or cross-eyed, the technical name is strabismus. With this disorder, the eyes tend not to orient together. They don't point toward the same object. This lack of coordination between the 2 eyes make it difficult to get them to focus on a single point or to change that focus. The main result is poor depth perception. The lack of coordination can be in the brain, in the muscles, or both. I had surgery when I was about 6 to align the eyes, but their alignment still isn't perfect. A side result of strabismus, what doctors like to call cosmetic, is that it throws people off. They can't tell which direction I'm looking, and not everyone is polite enough to not mention it. It was hard as a child, but I'm still self-conscious about how I look. Even worse is that I upset people when my eyes move rapidly from side to side. They keep saying, "Stop that!" but it takes me a few seconds to realize what they're talking about. I'm not trying to do it. It's not on purpose. It's an involuntary movement. This eye muscle disorder is called nystagmus, and it really screws up your vision. When my eyes are well rested, I have very little unwanted movement, but when they are tired or exposed to bright light, the jitter can be quite rapid. Interestingly, it's not a smooth movement from side to side. With nystagmus, the eyes move smoothly sideways in one direction, but make jerky movements on the way back. I don't notice the effect because I'm used to it, but if my damn eyes, as my eye doctor used to call them, if they stop moving so much, I could see a lot better. Nystagmus makes it difficult to get a clear image. With the eyes moving all the time, the image doesn't settle well in the retina. It's not based on what you look at, because some totally blind people have nystagmus too. I do okay with horizontal lines. The sideways movement of my eyes just extends them. The real problem is reading a number with multiple zeros. I can never figure out how many there are. I have to turn the page so the numbers run vertically. My other major pain is vertical blinds. Curtains are fine, shutters are good, but vertical blinds of any kind make my eyes go wobble-jobble. That's a technical term.